Okay, in the interest of time, Cheryl, we're still waiting for a few members, but I'll of course continue to let them in. So feel free to take it away.
Great, thanks, Katie. Well, so first of all, welcome to our committee meeting only 1 week after our last committee meeting. So thanks for your dedication. And at least the content is fresh in our minds. And now I'll hand it over back to Katie to do the tech check and roll call.
Perfect. Thank you so much. I think you guys are all very familiar enough with Zoom, so we don't need to do a tech check per se. But please, at this time, if you're having any issues hearing me, raise your hand and we can address it. Otherwise, we'll go ahead and move on and do roll call. This morning, as I call your name, please just share what your favorite season is and why. As we're in the midst of the holidays, it's a good question. So we're going to start with Cheryl Ramirez.
I think I'm going to say fall. Am I supposed to say why?
Yes.
I don't know. I like the changing seasons, the leaves, the activities. Yeah. And by the way, present.
Thank you. John Santa.
Well, for me, you'd think Christmas, but it's spring. And I'm here in spring because of just all the blooms, the flowers, everything exploding in colors.
Love it. Thank you. Chris Hogan.
I'm here. I think I like May the most. The bad weather's over and the summer hasn't become oppressive yet.
Thank you. Richard Gibson.
I'm here. I like fall, the days getting shorter and the crisp feel of the air. Thank you.
Charlie Swanson.
I'm here and I probably like summer the best because I like to swim outside.
Wonderful. And it doesn't look like we have Jeff yet. And then Bethany is just going to be a little bit late. So with that, Cheryl, I'll turn it back to you.
Okay, we'll start by checking the agenda. I'm not sure if we have we're going to do the timeline first. Okay. So we always want to see where we're at on the timeline. Today we are going to launch into revenue options, as you see on the timeline. We will, though, talk a little bit about the expenditures work that you're doing, and particularly Charlie today still. So the first question is, and this is about revenue, do you want to continue to refine the payroll and income tax or start with other options? And as you know, by looking at the agenda, the Legislative Revenue Office is going to give us a brief overview on what those options may be, and then answer questions, and we'll have a discussion. So any opinions about that, about where we want to start with revenue? Charlie.
Yeah, I want to look primarily at the income tax and payroll tax, but I want to include corporate income tax as part of that.
Okay. Any other, John?
Yeah, I'd like to ask that we look at a Medicare payroll tax. Think, that's how Medicare derives much of its income now. And I think it would make sense to keep that separately. I think it would give a very broad base to finance the Medicare piece of this, which I think will be important. It will certainly create a good reason for this to be in trust, like the Medicare Trust Fund is treated. From a kicker point of view, etc. And I think that doing that separately might have some advantages.
Yeah, completely agree. Thank you. Richard?
As unpopular it is, I think we still need to talk about a sales tax. Our income tax is already extraordinarily high. I'm not sure there's a lot of room up there. And also, although we haven't talked about it before in meetings with the task force, I think we got to look at property tax too. We need broad-based, low rate over.
We
Cheryl, this
we
is
did-
Katie.
Oh, go ahead.
I'm
Yes.
so sorry to interrupt.
Uh-huh.
But I, in my haste of getting things going, I skipped over Sam. She's also here. So I just wanted to
Oh,
give a
okay.
chance to say, Samantha DuPont, are you here? And what is your favorite season?
Hi, yes, I am present. And if I was still on the East Coast, it'd 100% be spring. Here in the Pacific Northwest, it's definitely summer because I'm desperate for sunshine. Thank you.
Thank you, Sam. And we also have Jeff with us now, too.
Great.
Jeff, if you're there, what is your favorite season and why?
Spring is my favorite season because it's a time of hope.
Oh, nice.
Thank you. Thank you, Cheryl. Back to you.
Thank you both. Okay, so we talked about sales tax, property tax. John, go ahead.
I have already made my comment.
Okay, your hand is up, so
I'm
that's
sorry, I'm
all
sorry.
on you again. Okay, well, that seems like a great place to start, and my assumption is that we can bring this all up with the Legislative Revenue Office presenter and have a discussion about that during that time. So thank you for that. Now we're going to just review the agenda as usual. We have a lot to cover. We'll continue to look at the new issues, again, the revenue, venturing into revenue. And as we agreed, certain committee members, some of us will work on the expenditures, continue to work on the expenditures data, and I'll talk a little bit more about that. Okay, so we're going to be talking about, I think actually I want to go into summary of feedback for the previous meeting. I think we're there. Okay. You can see the points here. I was just going to summarize them kind of in my own takeaways, and that is we had consensus on the use of a hybrid approach for calculating the 2022 expenditures using the NHEA as a framework and plugging in the best available data. That's point number 3. From the most credible data sources. And because this process will be more involved, it will take more time. Committee members agreed to work on gathering the data while the committee moves to revenue. So doing both at the same time. Additionally, Charlie volunteered to calculate a quick estimate from the Optimist data in the task force report, which we'll discuss today. And then finally, we agreed not to spend too much committee time on presentations and focus more on discussions and Q&A. And we're trying to adhere to that, although, we do need some form of presentation in terms of summarizing information that has been gathered and using, relying on some expertise too of our presenters. So let's see, anything else that I missed there? No, I don't think so. Okay, so now I'm going to turn it over to Morgan to review this new communication policy. Morgan.
Thanks, Cheryl. Just a quick refresher and background. I think you all know this, but just to start at the beginning, the Oregon legislature passed a bill in the 23 legislative session that made some changes to the public meetings law and defined convening more broadly than it had been defined in the past. And it included serial exchanges over time, and that quorum could be met through the use of an intermediary. I covered this in the committee orientation, so I'm not going to go into much more background. When the legal counsel for the board was advising the board on their policies and procedures, the board adopted a should avoid communication in the member communication policy. The policy never said that board members or committee members could not communicate. However, it did suggest really limited communication so that the convening of a quorum through serial communications or the use of an intermediary wouldn't happen. during the November board meeting, there's a discussion by the governance board, and they continued to uphold their commitment to transparency, but did want to update their member communication policy to more directly address the use of the issue of member communications. The new policy is in the slide. You can see they hold a firm commitment to transparency. That's actually in Senate Bill 1089 as it's called out. And also the board recognizes the importance to have some limited communication among members to facilitate the board's work and accomplish its deliverables. But it still kind of upholds the, communication among less than a quorum of the board is permitted as long as it does not create a serial communication creating a quorum. So it still really kind of has that bright line of not meeting the quorum requirement and needing to have a public meeting. So I won't continue to read that. But just to highlight, this policy also suggests that members of the board and committees take the public meeting law training offered by the Government Ethics Commission. That's a really good place to get more information. And if you have questions, the Government Ethics Commission continues to respond very quickly to questions. The board is working on a one-pager to share with members of the committees to get more information out beyond this. And the board will be talking about it at the board meeting this Thursday, and we'll be sharing it with committee members after that. I also did want to share one of the requests of this committee was, questions about could a discussion group happen where there were conversations and of less than a quorum, even if that meeting was properly noticed and the public was able to listen in. I asked the director of the Government Ethics Commission about that scenario. And she wrote back and said, since gathering and weighing information is part of the decision-making process, that means if a governing body members are meeting to gather information related to a decision to be made in the future by the governing body, they are engaged in deliberations. Deliberating should only take place in a public meeting, which requires a quorum. So really upholding that the conversations of the committee, even if it's less than a committee, less than a quorum, do need to be held in meetings. And meetings are a gathering of a quorum of the committee. So I just wanted to share, this is, we're continuing to learn how to adhere to that new law. And if there are additional questions that come up from the committee, I'm happy to reach out, or you are all welcome to also reach out as well. I think the practice of those supplemental meetings is probably our best practice at this point, to make sure that all of the discussions of the committee are in public. I also did get a question from Charlie about, can a small group work with the staff to come up with the agendas? And at the end of each agenda, we put in kind of next steps so that those future conversations of the committee about future meetings will happen in a meeting where there would be some conversation and deliberations about what those future meetings are. So we're really trying to follow this new law and make sure that the conversations of the committee are happening in public. So more to come, but I just wanted to share those couple of updates with you all.
Hey, Morgan, I wanted to mention a couple things, and then I have a question for you. Let me lower my hand. So first of all, I've taken the public meeting law course. I think it's like 2.5 or 3 hours, very thorough. And I think it's a good course. I got the impression and also the invitation from the Oregon Government Ethics Commission staff that they're very open to questions. If you have any, specific scenarios you want to ask them about. And they did that actually within the public meeting law webinar. They were just cautious to say that they can't act as your attorney. And also if it's a case, they can't give you advice on that case. It's just questions before it gets to that point. So I've thought it was very useful, and I would encourage you to take that course. The other thing, as Morgan mentioned, and I will reiterate again at the end of the meeting, is we are taking time at the end of each meeting to craft the agendas together. So be thinking about it, and we'll put together a draft agenda together. That will be always part of the process. And so my question for Morgan is, I believe one of the, I think in my mind anyway, one of the hardest issues to untangle is that serial communication. And I wonder if you could give us an example of what that would be, especially considering we have, we correspond so much by email that we can do that accidentally. And so I was wondering if you could just give us an example of what that would look like.
Well, I think the one that comes to mind is one that the attorney for the board counsel recommended, a best practice of using a BCC when emailing your fellow committee members. If you're like, when we send out materials, and when I say when we send out materials, when we send the committee the links to the meeting, we BCC everybody so that there's not email communication between committee members that could be seen over time, email back and forth about a topic that will be on a future meeting. Could be serial communications. If those communications back and forth are among a quorum of the committee, then that could be an unnoticed public meeting. So I think that that's the example that comes to mind most readily, where I think the past practice may have been that there were emails back and forth about what information we want the committee to say, and even in what information we want to be in a presentation could be construed as deliberating, because you're having that back and forth about an item that will be on agenda that will inform the committee about future recommendations. So that's one that comes to mind, but I think, yeah. So
that's helpful. So the takeaway for me is that when you're sending something to the committee and staff, you BCC the committee members. So they're not, and so that way you don't have exchanges back and forth, like responses to what you're sending. Okay, got it. Does anyone have questions about that? Okay, so thank you. Oh, John, go ahead.
Well, I'm just sitting here thinking for myself, I think you should be prepared to have frequent supplemental meetings, just so those of us who have seen something, who might have questions, could be better informed. I mean, these meetings to be focused solely on questions and clarifications. You know, for example, the materials today that Charlie developed and sent out, I think are terrific. But I have a few questions. I'm not sure that I want to, slow the process of this meeting down for those questions. But I don't want to get sideways of this by emailing or calling Charlie and potentially giving the impression that somehow I'm deliberating.
Right. Yeah. We are, by the way, giving Charlie time on the agenda to go through those materials. I hope Charlie knows that. Yes, you've got time. So we are deliberating today on the information that Charlie provided. Go ahead, Charlie.
I would second John's notion of more supplemental meetings. And I would also suggest that, because one of the things we're trying to avoid is not creating a quorum, I don't think we necessarily need to get a quorum at each one of these meetings. We certainly need staff to make sure that, it's open and done right, but we wouldn't necessarily need to have a quorum because maybe what we want to talk about is just background stuff that we aren't making a decision on, but could lead to a decision in the future, and it would be problematic if we somehow accidentally got a quorum. But I don't think we need to have everybody at every one, as long as people understand what's going on.
I would agree with that. Is that accurate, Morgan, that we don't need a quorum for supplemental meetings? No?
No, that is actually what I specifically asked the Government Ethics Commission about, if you could have a discussion group of less than a quorum. And that was what I read, that if you meet with less than a quorum, it's not technically a meeting, because to have a meeting, you have to have a quorum, but you have a number of people who are together. And even if we notice it publicly, those people would have discussion. That discussion could be considered deliberation, just as Charlie just said, that would lead to a future decision down the road. But those people are gathering information, and there is a risk if any of those people, say that you have 3 people in that meeting, if they talk to, if John and Charlie and Chris are talking in a public meeting, that's not a meeting, because it can't be a meeting without a quorum, but then they talk to Richard and Sam and say, here's what we talked about, then that talking to those other people is then serial communication and is the unnoticed meeting. So there's risk there.
Right.
And I'm just going to read what I got back from the director again. Since gathering and weighing information is part of a decision-making process, that means if governing body members are meeting to gather information related to a decision to be made in the future by the governing body, which is the committee, they are engaging in deliberations. Deliberations should only take place in a public meeting, which requires a quorum. So the best practice,
Got it.
we're going to have supplemental meetings, is that the supplemental meetings need to have a quorum.
Okay, sorry, I missed that particular point. But yeah, that's very clear, and now I understand. And hopefully we can settle on supplemental meeting dates where we'll have a quorum, and knowing that not everyone can attend every single meeting, but we'll just have to schedule so that we have a quorum. And I'm committed to being there, obviously. So, Charlie, go ahead.
I'm not understanding something, because I thought that the notion of public meetings is something had to be in public, and if somehow you had a meeting that as something that developed into a quorum serially, that was considered a public meeting. And so to me, it's the requirement isn't you need to have a quorum, it's that if you might have a quorum, it needs to be public. So my understanding is that you could have what is intended to be a public meeting, and you didn't quite get to make a quorum, and it's still okay. I don't think you need to have a quorum. You just have to have that possibility that needs to be public. I mean, that's my understanding, but maybe something's wrong there.
Yeah, Charlie, that's the question I asked, because I was under the same impression, and what she said was that's not accurate. I will. So I'm sharing the information that I have from the director of the Government Ethics Commission, and I asked the exact question that you are getting at.
Okay. I mean, so what if you schedule a meeting and somebody isn't able to come, and so you don't have a quorum, even though you've scheduled it? Do you have to stop the meeting?
That's a good question.
What they said was that deliberations should only take place in a public meeting, and a public meeting requires a quorum. And so if you don't have a quorum, you have the meeting, you are at risk for serial communication.
But it's public.
Well, the meeting that you have is public, but then if you talk to Richard after the meeting and he wasn't at it, that's the unnoticed meeting.
Yeah, I certainly missed that particular point. It took me a couple times to hear it. Thanks for clarifying that, Morgan. Jeff, you have a question or comment? think you're on mute. Still on mute, Jeff. Yeah, I still can't hear you. Okay, as Jeff works out audio. One thing I would just say is you guys are all committed to the cause, and we've got a small committee, and we haven't had any problems with quorum yet. So I would say if we get those supplemental meetings on the calendar, as soon as possible, like, I don't know, quarterly or something like that. And by quarterly, I mean schedule all of the supplemental meetings for every month, a quarter or something like that, will be more likely to be able to reach quorum, I would say. So with that, Jeff, did you get the audio to work? Did you? No, I'm sorry. Sometimes leaving and coming back works for me when I have problems with the audio. I don't know if that will do it for you. Okay, for now, let's move on to the guiding documents. I'd really like to close the loop on the use of the guiding documents, both the principles and the attributes. As you know, we have presented these at 2 different meetings and discussed, and so we now have a staff recommendation, which is to combine the principles, guiding revenue design, and the attributes of a sound financial plan into one document, and we use it to help guide discussions on specific topics like, I think we were talking about taxes last time, and I know there are principles and attributes related to taxes, so we can just look to the guidance document. So I agree with that staff recommendation. I want to see if there's any discussion, strong feelings about it one way or the other, so that we can move on from this. Yes, Charlie.
So is this discussion about the details within the documents or combining the documents or both?
It's combining the documents.
Oh, okay. Yeah, I think it might make sense to combine them. So
Okay.
I have discussion about the details later, I guess.
I don't know, Morgan, what do you think? Should we be talking about the specific attributes or principles at this time? We've got about 10 minutes for this particular item.
Yeah, if there's specific items on those documents, though you've had them on the agenda for a couple of meetings, I think now is the time though.
Okay, well, go ahead, Charlie, then.
So I would say for the attributes of the sound financial plan that many of these things are aspirational. It sort of says we must do this or this must happen. And I would say that on a lot of them, it's going to be really hard for that to happen. So I'm not quite sure what wording we should use to make it be that they are aspirational, but I think we want to understand that they are. Because we're not going to be able to do all this. So that's on the principles guiding or the attributes of the sound financial plan piece. Regarding the principles guiding revenue design, I would like there to be something about avoid fiscal cliffs to the extent possible. To me, that's an incredibly important part of sound financial plan. The unfortunate thing is I think it conflicts with, or it's at odds with, to some extent, with easy to understand, but I think avoiding fiscal cliffs is something we definitely want to try to do.
Yeah, I would just interject. I think easy to understand is one of our biggest challenges.
Yes, again, that's aspirational, I think.
Right.
I also think that we should keep in mind, and I'm not quite sure how to add this, but we should keep in mind federal tax expenditures. And that's one of the big reasons the task force went with payroll tax is because of the federal tax expenditures. So and there was one of the ones that was put as an addition, a possible addition, and that's no incentive for net movement of people. And I think that should definitely be added. And so that's one of the possible additions that was listed, and I think definitely should be added.
Could you repeat that, Charlie? I didn't get that.
So one of the additions that was there was, I think, no incentive for net movement of any group into or out of the state. And I think that should definitely be in the thing. So that addition, possible addition, I want to add. I mean, the other ones maybe, but I'm not. I don't have a great strong feeling one way or the other on the others. I would also say that the revenue plan should be likely to pass. That is something that I think is reasonable to have in there, but I think we also need to keep in mind that probably the best way to have it in there is to make sure that there's back and forth between that the communications committee looks at and says, take this tax plan out, or take several possible tax plans out and get feedback from the public and try to get to the point where that is the case. So I think that's something we want to eventually get to, but I think that that's a really important part of the communications plan to get there. So.
Okay, those are all good points. And I had forgotten that Morgan added these additional principles that we've heard from some of you. So
and one more, just to add that in, and that's the reserves question, which John Santa has brought up.
Right. Yeah.
And I'm not, again, quite sure how to add that, but there's kind of two parts to that reserve. One is, what reserves are we going to need in order to start the plan and to make up for financial instability? But the other piece is, what about the transition from private insurance and other public insurance programs to what we have now, or what we want to get to? And so those private companies are going to have reserves, and how do we get at that? And also, how do we stop the huge incentive when this transition is about to take place for private companies to all of a sudden say, oh, we're going to delay and deny so that the state has to take care of all this? So there's a couple of different questions within the reserves. So I'll stop there.
Okay. I'm starting to think, well, okay, we can get to consensus on the recommendation for combining principles and attributes, but this might have to be a somewhat living document as we add and tweak to these principles and attributes. I'm starting to think that, because this can generate a whole other long discussion on any of these things. John, go ahead.
Yeah, two things. On the current principles, I was struck by the last one, maximize federal dollars, because actually we're about to really have a discussion prior to, at least the best I know, having a discussion about maximizing federal match dollars. Charlie actually mentioned this in his document and came to the conclusion it was unlikely that we would be able to get additional Medicaid waiver dollars. I disagree. In fact, I think in the right circumstances, we could get an incredible waiver. There's a long history of states getting incredible waivers that I won't delay the group's discussion, and nor do I want to stop the discussion we're going to have about revenues. But there should be a discussion about waiver strategies for Medicaid and Medicare that we should be taking into consideration in terms of revenues. That was the first thing I wanted to mention. The second was, actually, I'm on the other side from Charlie on the additional principles, and would ask probably that additional principles document, have some additional discussion. Okay. I think the second bullet is very difficult to figure out. I mean, especially in the current environment, think about it. There are significant populations that are moving in the direction of states that offer some health services and away from states that prohibit health services.
Uh-huh.
Um,
Yeah, right. Okay.
so I'm really scratching my head about the second bullet there and how that would be feasible, or whether we would want to say that we could make it feasible. So I have concerns about the additional principles and would urge there be additional discussion.
Okay, also really good points. So I'm going to call on Richard. I'm going to check in with the other committee members, and then what I'd like to ask you to do, and we have to be careful about this. So I would like you to add your feedback, like whether on the additional principles or the existing ones, just email Morgan. And remember, we cannot be responding back and forth on that. Just email them so we have the whole list, and we're going to have to cover this at another meeting. But I would like to get to the combining of the two documents today. Morgan, did you want to say anything real quick?
No, I was just going to suggest exactly what you suggested, that
Okay.
the best way to is for everybody to provide their comments on those additional principles, send it to me, and I can put a comprehensive document together and use that for the meeting materials for the next meeting, so folks can see. And then yeah, that's a great way to proceed.
Okay, sounds good. Thanks, Morgan. Richard.
If we could advance to the next slide, please. I just wanted to ask a question about the next to last additional principle, which is a comparison of funding effect must include all sources of revenue. I don't know what that's getting at. Seems like a good idea, but what's it about?
I don't know who suggested it. I don't remember. So maybe Morgan knows.
You know, I don't remember.
Okay.
Okay, well, might need to tease that out a little bit. I want to ask Jeff if your audio's on, whether you wanted to say something about the previous topic, or if you have suggestions, or you have comments on these principles.
You bet. Both my video and my mute is now fixed, at least for the
Yes.
moment.
Yep, can hear you just fine.
The initial comment I was trying to make on the discussion of ethics was it reminded me of the Catholic Church in the medieval times when it was how many angels can dance on the head of a pin. Let's just use our good judgment and go forward and let the chips fall where they may. With respect to the revenue principles, I think it's two things. Number one, I think it should be broad-based. So broad and thin, if you will, rather than narrow and deep, since this is going to be a plan covering everybody. So everybody should be engaged involved, have some kind of support, subject to the usual discussion about those who cannot afford. And then secondly, when we get it done and everybody is satisfied, or at least we've had a thorough discussion, we should have a vote to affirm these are the principles going forward.
Sounds good. Thanks, Jeff. Chris, I know you had your hand raised and I see you.
Sure, I lowered it because I just planned to send Morgan my comments, but I'm happy to share them. I agree with some of the comments other committee members have made. Some of the additional principles especially seem really hard to get into without additional expertise or study. And then I wonder what our role should be with principles like designing a revenue plan that should pass a statewide vote. Of course, if the work we do generates a plan that won't pass a vote, then the work is pointless. But to try to get to that, I suppose we would need to delve into the politics. So should we be designing a plan that's just, or should we be designing a plan that adapts to the politics of this issue? And I like the idea of outsourcing that, but I wonder how much we should focus on that.
That is such a good question, and I personally have mixed feelings about that. I do think that I think that our focus as a committee is to come up with the best plan, you know, the most economically viable and, like you said, just plan. And I do think we need help with the political aspect. Both, I think it'll come through in the communications group, not that they'll be political, but it's the messaging, right? And then I do think it's the advocates who help also with the political part of it. That's my opinion, so. I do want to call on, thanks, Chris. I do want to call on Sam, if you have any comments, just to check in on the principles and attributes.
Oh, these all look great to me. Thank you.
Okay, thanks, Sam. And how about Bethany? I thought I saw that she's coming in. I don't know if she's here.
Yeah, I'm here. I don't have any other comments.
Okay, thank you, Bethany. Well, with that, then we'll proceed on to the next agenda item. And just like we said, if you have other comments or questions or ideas on the principles and attributes, you just send them to Morgan and we'll just create a big list and then we'll put it on the agenda next time. Jeff, did you have something else?
Yeah, this may be a bit contrary, but we're designing a business plan for 4.2 million Oregonians.
Mm-hmm.
Business plans get accepted, business plans get rejected when you're looking for funding. I think we need to design a business plan that will maximize our chances of getting support.
Mm-hmm. Okay, yes. Okay, I'm just making some notes here. Okay. All right, so we'll move on to the health expenditure discussion. And as we mentioned, we're going to spend some time on an update of the health expenditures data and namely on Charlie's task of the quick estimate. Staff pulled together the information that Charlie shared with us into these next two slides. And I'm just going to ask Charlie if you'd be willing to review this work and answer any questions of the other committee members.
Yeah, I mean, so I actually have corrections to what I did. I had
Okay.
other people looked at it outside of the committee and made some comments, and I realized that there was a couple mistakes. One is that when I was doing my own estimate separate from Optimus, the revenue needs, for private insurance, I did not include the cost of insurance, so the overhead. And then when I looked more carefully at what Optimus had done, they had included it. And so when I went back and included it, then my numbers came out roughly 2 billion higher. And then when I was looking closer at what Optimus had done, they had counted 2.1 billion of Medicare Part B expenditures or Medicare Part B premiums as revenue, which is they should not have done. And so both of us, as far as I could tell, had made a $2 billion error. And so my estimate now is that 20.4 billion is a more reasonable target for 2023 as revenue needs. And that would be without including long-term care and without including expenditures on capital equipment and structures. So I guess that's the corrections I have to what I had done. And I guess I'm open for questions.
Hey, Charlie, just to clarify, so the bottom line estimate you said was how much?
20.4. So
20.4. So that's in place of, on the far right, the expected revenue needs of 18.4. Is that right?
correct.
Is the
Right. Yeah.
Okay.
Charlie, I have a question. I'm reviewing this against the Optimus report. So I see where you got the 39.1 and 37.6. To get to the revenue needs columns, are you deducting any of the sources that are currently public to get to the delta? Is that what you're doing?
Yeah, I mean, well, so in the columns, page 13, page 30, revenue needs the 4 columns there. That's basically a interpolation of what Optimus had done. And yes, they had counted on revenue from federal sources and actually all current state sources as well, and said, what additional sources do we need? And so that's a further discussion about, can we really recoup all of those sources? One of the questions comes to the state sources, and that's for OEB and PEB. I mean, how are we going to, and not just OEB and PEB, but also all municipal employees, how are we going to recover the money that taxpayers pay for public employee health care? One of the ways we do that is through the payroll tax, but that doesn't get all of it. And so that's a later discussion we might have to get into. But yes, it includes all of the other sources of revenue that come in.
So if we adopt 20.4 billion for 2023, and we're trying to get to 2026, perhaps we apply these inflation multipliers down below and compound that a few times to get to a 2026 value.
Yeah, I would say we would do what our if you look at what we're adopting as the way to go, we would actually do analysis first, including the revenue analysis with a known year that we can check, like 2023 or 2022. And after we had done that, then we would project to some future year, which we need to choose. And so that's, I think, a later question. But yes, we would have to do that at some point.
Any other questions or for Charlie or comments on his work?
So I will also add that I think there's at some point the question that John Santa had brought up is worth discussing about, can we get more revenue, and we should talk about that at some point. I don't know if this is the right point to talk about that, but more federal revenue, I guess.
Oh, right. I would ask Morgan, is that something that we can address with the economist from the Legislative Revenue Office, or is that not in that particular discussion?
Good question. I think you could ask Kyle. I think the question of waivers and federal revenue, this is one of the areas where we have kind of a split between the committees. The operations committee is the committee that's kind of looking at federal waivers, and this committee is the committee that is thinking about the money from federal waivers. So I think we still need to have that conversation between the committees and kind of which bucket it falls into. And it's probably a both and, not an either or.
Is that something, Morgan? I know the operations committee just barely started meeting. Could we potentially schedule a meeting between the two when they get kind of down the road a little bit? Or is this something that we need to decide for our committee fairly quickly? I guess that's the question I have.
I think that it is something that you might want to bring up at the board meeting on Thursday. I think the board will be talking, the meeting on Thursday is a lot about the work of the committees and that committee coordination is a piece of that. So I think that would be a great question to pose to the board.
I will do that. Okay, John.
Yeah, Charlie, a couple of things. First of all, you made a comment about Part B And my recollection of the task force is that one of their requirements that did generate revenue to support the plan was we decided that all Medicare folks would have to purchase Part B, that the single payer would not pay to bring everybody else up to Part B, and so that sounds like additional revenue to me. But maybe other members of the task force or folks who are familiar with the task force disagree with my recall. So does that make sense? You're on.
Let me answer that. So yes, they're going to continue to pay Part B, and yes, that's revenue, but the revenue doesn't go to the state plan. The revenue goes to the federal government, and so that's not revenue that we have. And I did talk with another member of the task force about that particular question recently, and I talked with Warren George about it, and his understanding was that yes, that is going to have to continue likely, but that's a federal question, and also it's federal revenue. It's not revenue for the state plan. So,
well, but you understand where I'm coming from. My sense is that the task force, we were looking at that as, well, somebody's going to need to pay for this.
yeah.
So it is a cost
Yeah.
to the task force. And that my recollection is that decision to require that all Medicare folks check the box so that the Part B costs come out of Social Security did defray a significant expense. Yes, the money went to the federal government, but it reduced the amount of money we needed to raise from a practical point of view.
Yes, and as far as I could tell, again, this is my analysis of what Optimus did, is that they had not counted it as an expense, in that the state's going to have to pay that $2 billion, but they had counted as revenue. And so I think that if they'd counted an expense, yes, your understanding is right. But as far as I could tell, they had not. But and that's looking at the detailed data of what they considered as an expenses. So, but it's an open question. But part of the reason I'm pretty sure that that's the way they did it is because when I made the corrections for private insurance overhead, I could tell clearly that they had counted that as an expense, and that there was savings because of that expense. And so then when my numbers agreed there, I think it makes sense. So anyway, I'm still going with, at this point, until we come up with something better, at the 20.4 billion is our target for 2023 revenue.
Yeah, I mean, I wouldn't differ in terms of any number you land on, as long as it's in the $20 billion range, because that's around, I think, where we were with the task force, and whether it's 18 or 20 doesn't make much difference. The second issue that I would just need some education on is when you talk about out of pocket. What does out of pocket mean? Now, I would assume from this spreadsheet that does not include any costs for long-term care. Correct?
That's correct. That's correct. Yeah. So I have removed the out of pocket for long-term care.
Does out of pocket, is it defined as the cost that an insurance company or a payer doesn't pay that the patient has to pay? In other words, you start with the covered costs, not so it does not include the uncovered costs.
It actually includes the uncovered costs and the covered costs that are extra that people have to pay, and the costs for the uninsured. So there's a number of things that go into that out of pocket. But and when Optimus did their report, they split out the amount that the uninsured pay from the amount that is out of pocket due to things that, the extra things that people have to pay when they have insurance. And they also, sort of hidden in there, was the out of pocket for those on Medicare. And so these out of pocket estimates come primarily from the National Health Expenditure accounts. But when you put all those things together that Optimus did, they come pretty close.
So like specifically, does out of pocket include cosmetic expenses?
No.
Does out of pocket include expenses for supplements?
That's included as part of the cost of insurance. So it is the out of pocket that I'm using here and that was in Optimus reports was only for the services that were covered by the plan. So that's why it does not include long-term care, and it doesn't include the other kinds of, the cosmetic that you're talking about that wouldn't be covered. So yes.
Yeah, okay.
And again, this is the best we can do. So, maybe it does cover some of those things, but the attempt was to not. So yes.
Yeah. Okay. So I understand better. Maybe there's a little bit more there that could be saved, but I understand it now.
Okay.
To pile on to John's question, I am curious about whether out of pocket includes all of the dental, vision, behavioral health care, probably hearing that Medicare patients have to pay for out of pocket. That is pretty big expense.
Yes, the intent is that it's including that. But again,
Okay.
those are things that are hard to come up with, but the estimates are from sources that try to include that to the extent that they can do
Great.
it. So
Got it. Thank you. Any other questions for Charlie or comments before we move to our next topic? Well, I just want to say, Charlie, thank you for all your work. It's really great. Appreciate you. Okay, now we'll review the assumptions about transferable revenue sources that are potentially for the Universal Health Plan. And the data that we're going to look at is from RAND and Optimus Research. We're going to ask Janine to briefly present a couple of slides just to summarize what she's found, and then we'll just open it up for discussion. So I'm going to hand it over to Janine.
Hi there. Hello again.
Hi.
So we can go on to the first slide. So the question to just remind us is which of the revenue sources that currently support healthcare that's in place in Oregon now are potentially available for the Universal Health Plan. So next slide. And as we talked about earlier, today as well, there are multiple sources, both federal, state, and personal funding for all of the current lines of coverage, be it private, through the marketplace, Medicare, Medicaid, and then the federal programs. But I think the task force previously had excluded that one. Next slide. So I went back through RAND and Optimus looked to see how they approached each of the current sources and whether they were transferable. The marketplace is a key one. That is the through the Affordable Care Act, ACA, and it provides premium tax credits and cost sharing reductions. And notable for Oregon is starting this past July, the Bridge Plan, which is Oregon's version of a basic health plan, is using some of those dollars for the coverage for that gap between Medicaid and those who really couldn't afford a plan on the exchange. And just realize that neither of the Bridge Plan was not in existence at the time that RAND and Optimus did their work. So you do have to meet some requirements in order to potentially transfer this funding source over, such as the essential health benefits, which the benefit committee is, looking at, and plans like PEB and Medicaid currently and Medicare all meet those. And you just would need to fulfill any requirements. And again, it would probably require a waiver specific to the marketplace. There is concern on a federal level for this, is whether it's up for renewal for some of these subsidies right now in Congress. And so it's uncertain exactly what the future of these all are as we go into a new administration. So we just need to be cognitive of that. The federal outlays for Medicare in both RAND and Optimus, they felt that if it's allowed, and again, it's a big lift to get that permission, but they included those in their estimates, as you were talking about earlier. Federal match for Medicaid, and I think it's the RAND specifically, they sort of isolate out general Medicaid and the Children's Health and Insurance Program. In Oregon, we kind of blend those all together in the Oregon Health Plan. But as long as you were meeting the federal requirements to ensure that the people who are eligible for Medicaid are getting the benefits that they're required. So it requires some adjustment in the benefit package, potentially, again, an issue that the Benefits Committee is looking at. There is a concern there also. Currently, we have a much higher match for the newer expansion population, thanks to the Affordable Care Act. That is potentially a place to cut. They're at 90% match versus the usual match is closer to more 50-60%. So there may be less dollars there if the feds do anything there going forward. Health benefits for federal workers, if they're included, then they were included in the RAND consideration, but they were excluded per the direction of the task force in the Optimus report. And then the community behavioral health, as you remember, we talked about, was the infusion of dollars from the state into behavioral health, but there is some SAMHSA, which is the federal level mental health and substance use agency. There are some federal dollars there. Optimus did put those into their calculations. Questions on this slide? No? We can go forward to the next one. And then from a current state funding perspective, you have the general fund, and we're going to go through some of this a little bit with our the revenue folks coming later. And you had talks about this at the board level as well. There are cigarette taxes as reviewed. They're a little higher, more dollars designated there than when either of these analyses were done. And then there is the provider tax. And I know that he has a slide after the break to talk through these three taxes. They're paid by the hospitals, and there's a long-term care one, and there's a health plan one. But in both cases, they didn't feel they will have be transferable. The community behavioral health, again, it's the state investment there. It's hard to say. There was a lot of money put in recently, whether that will be the case or how it will flow when you get to, say, 2026 or beyond. But that's just a consideration that there might be some a gap there depending on how much the investment is. And then there's the state portion of the PEB and OEB dollars, and in both cases, the modelers felt that those two funding sources would go forward. Healthier Oregon was not in place at the time of those. That's where we have state dollars going towards services in the Oregon Health Plan where the federal government won't pay or won't match. So there is some dollars there that wasn't available at the time of either of these analyses. Questions on this slide? Next slide. And next. Oh, John.
Yeah, just that line on other public employees, municipal public, employees.
Oh, yeah. Yeah, sorry, I missed.
Yeah,
Yeah, so Rand didn't talk about it. Optimus put a dollar amount in their analysis for this. It's I'm assuming there's not a lot of detail in the Optimus, but I'm assuming it's the the city county portion of the payment they have for their public employees. Now, how you get at that, I mean, you could, whether that's the same way you would get at it to get the state dollars, or is that just another employer that pays like any other private employer? So depends on how you would structure getting those dollars.
right. I mean, I had questions that you've answered about Healthy Oregon and the mental health. I mean, my first objective in asking about these is to do our best to try and quantify what our public organizations, through taxes they collect, currently funding in terms of their health care for their employees, as at least a to try and figure out, well, what would they no longer need to pay? What savings would come from a single payer? And then, of course, trying to figure out a mechanism to bring those tax dollars over to whatever we would do. I acknowledge it would be challenging, but I think that listing these, and so I would ask going forward, we list Healthier Oregon. We list what I think is it 300 million, 500 million, and additionally in mental health dollars that Governor Kotek has put in play since the task force met. To begin to see, well, if everything worked the right way, here's the revenues we would need. If everything worked the wrong way, kind of a best case and worst case scenario. And this is a good start, and I really appreciate this list and the discussion, Janine.
And remember the cost growth data did have those identified, and they do comment in there. I think they comment that Healthier Oregon is inside the Medicaid line in there. They didn't have the bridge plan at the time of the last cost growth data set, the 2022 data.
Right.
There was another question. I don't know, Charlie, were you next or Cheryl?
Yeah, I think I might have been next. So I've got I guess a question related to what John was just, or maybe a request related to what John was just talking about, that I would expect that the Oregon Health Authority has pretty good information on expenditures in Healthier Oregon plan, and also the Cover All Kids, which I think is pretty small. But also OEB and PEB, and it would be good to get that data for a number of years if we could. I think that
well, again, I think the PEB and OEB are in the cost growth identified separately.
Are they identified separately? Okay, great.
I mean, I think they may be PEB and OEB together, and then just remember that OEB doesn't have all school districts, that the larger school districts are self-insured or doing their own thing, and they're not buying into OEB to purchase their coverage.
Okay.
So they would fall more in the private, somewhere in private, or if you dug into the municipal funding.
Does the Oregon Health Authority have that information about how much that is, or is that not something they collect?
I doubt that OEB would collect. I don't think OEB collects that data.
Okay.
But I'm not at the Health Authority anymore, so I can't say. Cheryl?
I just want to note on the behavioral health investments, particularly 21 through 24, a big chunk of those investments were for facilities, and we're not including capital expenses, so we'd have to pull that out. And
It's a
some
good,
of the funding was one time. We're sure hoping that it will roll up. In terms of the services and the workforce we need in the behavioral health system. But of course, we would have to take out all that those capital investments, which we really appreciate, but obviously won't be ongoing.
and Charlie?
And I, just to comment on what Cheryl just said, I think we do want to try to quantify capital investments as a separate category to the extent that we can, because I expect that that's going to be something that the board will decide similar to what the task force decided. That is, or at least that we want to leave the option that they could decide that that's something that they would want the plan to cover. So
Next slide. So the key things that are identified here are what's not captured in terms of easily transferable, and hence the conversation in Optimus and Rand is that by doing some sort of revenue, payroll tax, any sort of taxes, you're sort of trying to compensate for this whole, which is the employer's contributions, and the family and or person's contributions. There is a federal income tax deduction that is eligible, that the employers are eligible for. There was some comments in Optimus about how that could be that would still potentially be available for their contribution if you had an employer or payroll tax. The revenue needs to be replaced for that people put in. And out-of-pocket costs, if you currently they're paying for, say I have a 80-20 plan, they're paying 20% of that. So if you have no cost sharing, there's a hole there as well. And then the charitable care in Optimus, they modeled a 10% based off of what was in the hospital data, financial data, as a potential direct benefit that could be used, as opposed to, say, where hospital systems will often support a community event like the driving your bike all over the bridges in Portland. So there's lots of ways that charitable care is reported in, and so they just took it as a 10% chunk in theirs. Rand didn't include that. Richard?
Yes, thanks, Janine. Going to the top one, employer contributions, income tax deduction. So how, what you're talking about what employers spend on health insurance is not, but that's not revenue that is
No, that's true. It's not really revenue. It's just I put it in more as an awareness that there, as you're thinking about your revenue sources, that's as you think about saleability to the world to do this. If they're paying something now that gets deducted, they might want to be paying something in the future that could get deducted. So do you structure it? Sam? Samantha?
I wondered if you could say a little bit more about the charitable care calculations in the Optimus report. Was that based on actual data, or was it truly just an assumption of 10%?
No, in the hospital financials, they report how much they put into charitable care. That's reported to the health authority regularly. And they just took the dollar amount, and they don't always, it sounded like they couldn't tease it out specifically. So they just took 10% and put it in their calculations. It could be higher, it could be a little lower, but that's where the way their model was built.
Okay.
I think we're getting confused between charitable giving to the hospitals and care provided by the hospitals to people that don't pay.
This is care provided by the hospitals. I mean, it's dollars spent.
Exactly.
And some of it goes to personal care. They guessed 10%, and the other dollars the systems put out go to other community events.
I don't know if you could point me to those financial statements from the hospitals, but I'm curious because I believe that some separate from charitable care include Medicaid revenue losses as part of their community benefit calculation. So
That's
would very
possible.
much be interested in seeing.
I
those.
haven't looked at that in a long time, but it's part of OHA's Office of Health Analytics. That they collect those reports. And maybe staff can get you the the website. Chris?
I just wanted to put this in the context of Charlie's analysis and make sure I'm understanding right. So we've summarized all the public dollars, many of those are transferable. These 4 items, this is how we're currently financing that roughly $20 billion. Is that right?
Yes, I guess I would say that, what you're paying out of pocket and what you're paying in your portion of the premium costs are the part that's not going to happen if you choose to go forward with no cost sharing. But I also wanted to raise the issue that there may be some other gaps in some of those other sources, depending on what happens with the current structure of the Affordable Care Act, that those federal dollars particularly are, some are at risk if there's further changes. And then just a realization that the Medicare is very complicated and very difficult. And whether there are other another state like Vermont worked kind of around it and did more of a supplement to the existing Medicare, so they didn't have to get a waiver. Some have chosen not to put Medicare in, so that how you structure it. But again, that's not this task. It's just an assumption to think about that you might need a little wiggle room on your dollar estimate, or maybe think about this is what you want to do to plug what Charlie is saying is 20 million, that you might need to have a little wiggle room there in case some of these other sources don't come to fruition. John?
Yeah, I just wanted to share an anecdote that made me feel like this general topic was important. A colleague was talking about a conversation they were having with someone at a community college meeting about single payer, and they said, "Oh gosh, that'd be just great if there was a single payer. The state would pay our health care. Then we could do something with all the dollars that were saved." That's a problem. That's a challenge. And there's, I think when you see how much potential money there is involved there, to the degree possible, it would be nice if those dollars could be redirected to the single payer, rather than be used at the discretion of a public organization, whether it's a school district or the police or whatever. So, I mean, this is a very tricky topic, but it's a large number. It's a big number.
I think that wraps up my section. Cheryl, I didn't know what else you wanted to touch on in terms of that, or if you want to ask if there's any other.
Yeah, I would just open it up to the group for more discussion. I think this, I don't even know how to begin on the topic that you are raising, John. So I don't know how to get started with that. I just don't have anything to offer to start with that. So maybe others do. Or if you have other discussion on any of the any part of the summary that Janine presented, that this is the time. I believe our break is probably at 10:30. Is that accurate? Is that correct? I have a different time on my notes, but I just want to make sure I've got
10:20 is what the agenda says, but it's kind of up to you.
But then it has us starting with taxation and revenue at 10:45, or at least on my notes. That is
Yep. That is an error now that I see on the agenda.
Okay,
Sorry
so
about
why
that.
don't we, well, we'll just see what we get and we'll break whenever you're done talking, but at least by 10:30. We'll take a 10-minute break and then come back at 10:40. How about that? That way we have a whole hour dedicated to our first real revenue topic. So let's do that. Charlie.
So this relates to something that John was mentioning, had mentioned a number of times, but also relates to the topic we're going to talk about, the revenue topic. And it's one of the ways to get at a substantial amount of the money, the public money that goes into employee health care is with the employer payroll tax. And that will not get all of it because the employer payroll tax is likely to be designed to be somewhat in the amount that would raise about the same amount of money that private employers pay for their employee health care. And we know that public employers tend to pay quite a bit more. So it wouldn't raise all of it. But I think if you do, at least for the municipal and county employees, if you try to get much more of that, and you have it, you differentiate between the kind of employers, I think you might run into some ERISA problems. I think that you might be able to get at the OEB and PEB money more easily, but I'm not sure we should. I think that's a discussion that we probably need to have at some point. But to me, trying to get at too much of that beyond just the employer payroll tax could be problematic, and it might actually be useful to say, no, you can save a little bit of money with the single payer plan. Of course, that means we're going to have a higher tax rate for everybody else. But I think we need to be careful about trying to say we want more than just what an employer payroll tax would raise. I'm done.
Thanks, Charlie. John?
Yeah, the other source not mentioned here, and appropriately so, because it's at least a 2 or 3 step. In some of Charlie's documents, he mentioned, I think when he was making a general statement about other income, and he mentioned investment income. If there's investment income, there's a bunch of money sitting there that was invested that's probably in reserve funds, all of which were appropriate and needed. But we know from recent history that some of those reserve funds are very large. They're very large. Salem Hospital had a reserve fund of $1 billion at the start of the pandemic. $1 billion. Care Oregon, in its transaction or its scan, disclosed that it had a reserve fund of $1.3 billion. These are very large amounts of money. I'm a longtime supporter of Good Samaritan Hospital, where I trained, and there's a Good Samaritan Foundation that's been in play for decades. Is mostly, I think, patients and other supporters who made donations along the way. Colleagues have told me it is incredibly large foundation. And what should happen with that money? What should happen with the income from that money? Should that, for example, be used to defray some of the capital expenses that folks are going to have? Should regions be allowed to take those reserve funds and put it in a fund that will serve their region going forward in a single payer, whether it's in capital investments or others? Can an argument be made that those reserve funds have come from, in large part, public funds that came to those organizations? That's a very large amount of money also. So just wanted to mention that.
I'll pipe in too. I'm curious, John, I'm trying to think of the mechanism by which you could collect those funds. I mean, we're talking about private organizations that have been bearing the risk of health coverage in Oregon, you know, their argument would be, you know, this is our historical profit. You know, what's the mechanism by which the state could capture those dollars?
Yeah, Chris, if you're operating in a for-profit environment, there is no mechanism. Those dollars are gone. You know, no argument, I think, about that. It clearly says those are the shareholders' dollars. But if you're operating in a nonprofit environment, which is the environment that many organizations are operating in, many of the CCOs are nonprofit, many of the hospitals are nonprofit. When those organizations, if they do not continue after a single payer, they presumably would need to take all the money that's left and put that into a foundation of some sort. And you know, it brings up the questions of, is it possible we could create a cooperative model in which organizations would see, if you're willing to do if you're willing to do clearly community beneficial work here as a single payer, we're willing to continue these funds as long as they benefit the community. So, you know, one of the things is, I think, to get our heads oriented to a cooperative model rather than a competitive model, because I think this is going to be very difficult as a competitive model, but, you know, could potentially succeed as a cooperative model, and hope that the nonprofits in the state would agree with that.
Yeah. Thanks, John.
Thank you. Excuse me. Thank you. I think John's raised a very important point here, which with two elements is, number one, there are a number of hospital foundations. Legacy, with each of its hospitals, has one. OHSU has one. Providence, and throughout the state, there are these various foundations with substantial dollars that they are investing to provide benefits to the hospitals. So the question, as John points out, is what happens to those dollars that are being invested on behalf of medical care? And then secondly, if we have a single payer universal health care, however we wish to describe it, does that eliminate the incentive of anybody who in the past has made contributions to those foundations? I think that's something we have to factor into the thinking on the revenue side.
I mean, I think the answer is yes. I feel organizations would be less likely to contribute under a public model. You know, it's got me thinking about reserves and the significant reserves that the state would need to hold to cover losses and cover volatility. And no doubt there are significant reserves held by the CCO system in Oregon, and many of those entities are private. You know, the state could potentially benefit from those reserves if, in the structure of the universal health plan, there was room for the CCOs to participate in some way. For example, under some kind of cooperative model. Just a thought.
Thanks for this. Yeah, go ahead, John.
Chris, I'd just point out that the task force had a concept that doesn't get much coverage, if you will, and that would be to create regional entities that would be owned by the single payer, but we're meant in some ways to be the vehicle that a CCO of the sort you're talking about could step into, and that regional entity would have substantial resources, including capital investments. And that regional entity would have significant abilities to respond to the community's needs. So I think a mechanism of the sort you're talking to hopefully could be designed and be attractive to the CCOs, or at least the ones that were, for profit. I'm sorry, not for profit.
Yeah, I was going to echo that comment. Regional entities weren't really spelled out as CCOs, but I got the impression that that was what was implied in the task force recommendations, that would be the transition to those regional entities. Well, thanks for this discussion. I think there's much more to come in this particular topic, to untangle, but there were some really great ideas and that we need to kind of delve into more. So we'll certainly put this as an agenda item soon as we're talking about revenue. So with that, I think we'll have a break for 10 minutes and we'll come back around 10:40. And that way we'll have, a whole hour to really look at this first revenue agenda. So thanks. And we'll see you in 10.
Hello? Hi, Robin.
Okay, we'll get started again as soon as everyone turns on their cameras. I know you're there, and I want to make sure Kyle has joined us. It looks like it. Okay, so can we get started again? I'm just going to go for it. Okay, so as we mentioned, Kyle Easton, who is an economist from the Legislative Revenue Office, is going to review and post some considerations for the committee. We've asked him to briefly review the slides, but questions, comments are welcome. And I'm going to ask Kyle if that's okay, that we can just ask questions while we're on a particular slide or comment, so it's easy just to see it right in front of us. And then after we go through the slides and discuss those, we'll open it up to any other discussion that we have. Is that gonna work for you, Kyle?
Yeah, that sounds good.
Would you like to watch for the hands raised and just call on people yourself, or would you like me to do that?
Yeah, I can keep an eye on the participants. Try to watch.
Sounds good. Thanks, Kyle.
Okay.
Hand it over to you then. Thank you.
Great. Thanks, Cheryl. And yeah, it's good to see you all again. I'm Kyle Easton with the Legislative Revenue Office, and it's been a month or two, I think, since I saw you all online as well. But yeah, so I've been listening to the discussion today. I've made some notes on some of the questions that have come up. So I'll try to work that in as I get to the slides that I think kind of pertain to some of the topic areas. But yeah, as Cheryl mentioned, the goal today is really for this to be an interactive discussion. So please raise a hand and I'll try to watch for that and call on people, because that'll be easier to facilitate the discussion. And really that's what the slide deck is all about. But if we want to go ahead and move forward one slide. So yeah, the general idea here was thinking about revenue design, really keeping this more of a high level or from a policy perspective, not really getting into any specific numbers. I have some in here for context, but this isn't about rates, base, here's what the numbers will be and those type of thing. It's more of what are different types of taxes that are already in place. They give a good example for ways to think about potential revenue sources moving forward. And so the ones I have here is the personal income tax, a payroll tax, or a tax on labor is another way to think about it. The healthcare provider taxes, I have a slide on that at the end just to give some sense of where those are today. And then the final thing is just a discussion of fees. So we can go ahead and jump, we can go one more. Yeah, thanks. So in terms of revenue sources, there's really two buckets in which to place things. We have taxes and we have fees. And so taxes, as it's described there, these are really your principal means of financing the government. These are the ones most people kind of know about, and they're really about, these are required payments or compulsory payments. And the idea here is a tax is a way of raising revenue. You can think of it going into almost a general fund and then it's spent. So using Oregon's personal income tax as an example, it raises revenue, That revenue goes into the general fund, and then it's up to the state legislature to then disperse those revenues. So it really is about the revenue itself and the expenditure are not connected closely. There's obviously going to be a relationship there as people receive services and benefits from state or local governments, but it's not a one-to-one. That is more similar to a fee. And Charlie, I see you have a hand up.
Yeah, so I just wanted to say is you said that the revenue goes into general fund. Is that a necessary thing for income taxes to go into, or could you design which the task force proposed, a new tax on income that goes into a dedicated fund that is not the general fund? Is there any constitutional requirement there, or?
There is, and let's hold that one until we get to the personal income tax slide specific, because I do have some note on that. But yeah, that's an excellent point. So yeah, taxes, it doesn't have to go to a specific something called a general fund, but that's just a distinction. But I'll get into the personal income tax one more specifically, because that's important in the consideration for you all. And then the second bucket I had here was fees. And fees are generally going to be a charge that's directly linked to recouping the cost of the service or whatever it is the individual is receiving. So tuition and fees at a higher education would be an example. Another one might be something like the $5 you pay at a state park or something like that, where it's really a close linkage between what you're paying for and what you're receiving. But I would say, while it's easier to categorize them or have two categories, taxes and fees, it's not always easy to distinguish the difference between something that raises revenue, whether it's a tax or whether it's a fee. So it can sound simple, but it's not always that simple, unfortunately. And let's go ahead and jump forward one more. Okay, so why does it matter whether it's a tax or a fee? Part of that, or one of the big considerations, is Oregon's Constitution has two requirements related to taxes. The first is that tax legislation originates in the House. So it would start in the House and it can move its way to the Senate on its way to being adopted. A second requirement would be the 3/5 requirement. So in Oregon, most legislation can pass on a simple majority through the state legislature. Bills that are bills to raise revenue require 3/5. So that means 36 votes in the House, 18 in the Senate. It's a higher bar to clear in order to establish a new tax to raise revenue. And that's an important consideration. Fees, if something is considered a fee, it's not a quote bill to raise revenue, so it can pass with a simple majority. So that's a key distinction on whether something's a tax or a fee, is just simply how many votes you would be required to receive to move it through the legislative process. Yeah, Charlie.
So a question related to this now. So if the legislature were trying to pass a bill to raise revenue, but they weren't directly passing it, they were passing it in order to place it on the ballot, would that also require a 3/5 vote to place a revenue raising measure on the ballot?
Yeah, good question. I can't guarantee this. I'm pretty sure I was thinking about this as you were discussing it earlier today. I think a referral would be a simple majority if you're referring it to the voters. So that would be something in terms of a plan like this, sending out a referral, whether it would be multiple taxes, that could be more challenging. I think on the initiative side, you run into a single issue clause, but for the legislature, they could refer something to the voters for their consideration. And I think we've had this more recently with the cigarette tax as well, where it was a referral of the voters, so it was a simple majority because it wasn't technically raising taxes. It was asking the voters if they want to do that. So that could be another strategy, yes. Okay, so we can go slide 33. In terms of the bills to raise revenue, this is really getting into the area of legislative council. So this is a legal thing. This is not an area that legislative revenue would have any determination. It really is legislative council. They do make a notice on a bill that has, it's in quotes, they're providing for revenue raising that requires approval by 3/5. So you'll see that if you're looking at any previous legislation, that is at the top of the bill that describes whether or not legislative council through kind of their process, they've decided that is likely to, or that is a bill that will require a 3/5 vote. And really that decision process is legislative council is thinking, well, based upon court decisions, if someone challenged this, would it require the 3/5 vote? How would the Oregon Supreme Court view these things? How would tax court view it? So that's based upon their determination. And then it's up to the legislature to get those votes to pass that bill. I have some reference here on how legislative council has interpreted this. I won't go into too much detail there because this is really a legal question. But one of the important considerations is it doesn't matter if you call something a tax or if you call it a fee. It's what is it? Is it, you can call something a fee. I gave an example here. It's the last bullet on this slide. Oregon has a document recording fee for affordable housing. It's called a document recording fee, but it functions as a tax. And therefore it was required to receive the 3/5 vote requirement. So you can call it a fee, but if it acts like a tax, it still is subject to these 3/5 requirements, origination requirements in the House. So naming convention doesn't matter. What something is does matter. Okay, so into the personal income tax example. Thanks. The personal income tax, it's a large tax base. This has been discussed with you all before. It's based upon earned income. You can grab different things. Earned income would be wages, is probably the best example. But it would also include things like business income from pass-through businesses, your sole proprietors, S-corp businesses that are passing income through. You could be grabbing some retirement income, possibly. This is using our existing income tax base, if that retirement income is taxable. So the committee's heard Social Security is not taxable in Oregon. That's in the Constitution. There could be other sources of retirement income that is not taxable because it's in a tax deferred account, something to that effect. And then personal income tax also grabs capital gains. So the takeaway here is the personal income tax is larger than just a payroll tax. It's a larger tax base. Oregon's tax is connected to the federal tax. So if you all were thinking about utilizing the personal income tax for your needs, that the existing tax base, that is based upon federal tax law. So that can put things up in the air a little bit depending on what, if anything, changes at the federal level regarding personal income taxes. So it can be a way to cede some authority to the federal government when they make changes. It depends upon the structure, but it's something to keep in mind. Yeah. Oh, Charlie?
Yeah, related to that last comment that you just made, hasn't Oregon said, when the federal law changes, they sometimes say, oh yeah, we'll just go along with the federal law, but I think they've also decided we're not going to go along with the federal law in that case. So don't they have the authority to change that if they wish?
Yeah, that's an excellent question. And it all depends upon where you connect. Different states do it differently. In Oregon, we connect to the definition of taxable income. And we have really, it's a rolling connection is how we describe it. So Oregon's status quo is we're connected to federal tax law. And then if something changes at the federal level, the question then often comes up, does Oregon want to stay connected? Because the automatic connect is we're connected to whatever the feds do, and then Oregon needs to disconnect. It can be flipped the other way, and it is a policy call on maybe it's a status or it's a static connection. So then if something changes at the federal level, Oregon then chooses whether to adopt those federal changes rather than to choose not to adopt. It's all about where your starting point is. But it is something to keep in mind. And there's a good example right now of where there's definitely a lot of consideration at the federal level of expiring provisions and how that will impact things. Sure.
I think you kind of just answered my question. I wanted just to get my head wrapped around this concept. I was looking for an example, and maybe that's an example, or how this would be operationalized, where we're going to use in this plan some percentage of personal income tax for the universal health care. Like, how would that be operationalized then to disconnect from the federal income tax?
Yeah, if the status or the way you would all set it up, or the way Oregon is right now with the personal income tax, we do have that rolling connection. So it basically requires the legislative body to disconnect. So that's something they review annually in maybe the short session as well, or in the long sessions, it comes up. We do have a different way in which we connect, which is well, I won't really discuss that. It probably doesn't really pertain to what you're all thinking about, but it really becomes the question is, do you want to connect automatically, or do you want the decision to be, no, we connect each year? And then it really changes the discussion on whether the question is disconnect from federal changes, or yeah, adopt these federal changes. But otherwise, being automatically connected just keeps things updated. So there's certainly an upside in that as well, of being connected, and that's what a lot of states choose. But where you connect to a federal tax code also matters. The lower down the stream, if you will, where you connect, the more federal provisions you adopt to. So you can connect at different points to try to limit changes at the federal level that could affect Oregon. And there's certainly different ways in which to move forward with this. It really is that high level discussion, but you can think of it as, do you want to connect to itemized deductions or something like that? And tax rates and such, those don't really affect Oregon. It really is about the defining of the income. But it's considerations where it's like, that's the type of thing where your revenue base can shift without a policy change by the Oregon legislature. So it can change the revenue flow.
I think I'm tracking, probably we'll need to revisit as we get further into the details, I'd say.
Okay, that sounds good. And I'll make a note of that as a continuing topic, because it's a big one. Yeah. And Charlie?
Just now, you said to put off my earlier question till I guess we got to personal income tax, and so now I have that question. Again, it's essentially, can you tax income and have it not go to the general fund? Or how could you possibly do that? Or what would be ways to get it to be protected from the kicker and from other provisions, to get a separate fund?
Yeah, so this is going to be a legal question. So it's one I will try to hit some of the high points, but it really is going to be one that is a better question for whether it be legislative counsel. I don't know if you're all working with the attorney general, how you all would solicit legal advice on this, because of course legislative counsel works for the legislature and the members. But the way it's been described in the past, and I would say I won't go as far as say this is 100% settled, but this is the best way I can describe it, is the personal income tax has been identified as a general fund source. And general fund sources is really what determines whether there's a kicker or not. So instituting a new or piggybacking off the personal income tax in some way, even if the revenues themselves are dedicated to something other than the general fund, there is a good chance that it would still be considered a general fund revenue source and therefore subject to the kicker. So it'd be part of the kicker base. How that affects the revenue and the expenditures, that's going to be more of a question of how the legislative process works and how they're doing their appropriations. But if you use the personal income tax, it's very likely that that's going to be considered part of the kicker base. It'll be hard to avoid, and certainly just dedicating the funds to a different fund. The reason that the idea is that probably is unlikely to work is that Oregon could simply do that today and just don't dedicate the funds to the general fund, just dedicate them to something new, just call it something different, and you've worked around the kicker. So that's what I guess I've heard. We've heard LRO from legislative counsel is the way to think about it. But again, that's a question more specific to, the tax lawyers than one that I could answer. But I would definitely keep that as a placeholder of likely it's subject to the kicker. That'd be the takeaway, I think. And to that point, that's the time series chart you have there is really showing the pre-kicker dollars, revenue from personal income tax, the liability for each tax year, and the post-kicker. And you can see some of that. The orange line is the post-kicker. It tracks fairly closely in terms of historically. You can see things picking up a bit in 2015 where you can start to see where the kicker comes in. And then it becomes more obvious in the last few years, and certainly 2023. But that was a record kicker, a record of a record, really. That was just a massive kicker. But it is an important thing to keep in mind, where it's like those do occasionally happen. And certainly kickers of decent size, that's just something that's there. It has to be I suppose, managed in terms of cash flow, revenue flow, and such. In the last bullet there, this was a discussion topic that you all had earlier as well, is the federal deductibility. On the personal income tax side of things, there is an itemized deduction for taxpayers for state and local taxes. So personal income taxes that someone pays in Oregon can be deductible on their federal taxes. Under current law, though, right now, that is limited to $10,000. So that limit technically goes away, but it's part of the discussion that's happening at the federal level. So it's unclear what that will be going forward, whether it'll still be at $10,000, something higher, or it'd be eliminated altogether. But that is an important thing to keep in mind, where if you have a personal income tax for universal health care, the deductibility of that may be limited. So as things are shifting, as costs are shifting, I would say it's an uncertain future on how that deductibility would work on the individual side. On the business side, whether or not they're, paying a tax or purchasing health insurance for their employees, that's probably going to work out just fine deductibility wise. Because instead of deducting their expenses on the insurance premiums, they're now deducting a tax that you're placing on them. But on the individual side of things, there could be implications there. And there could also be implications on, right now we have itemized deductions for medical and dental expenses that exceed a certain amount of a person's income. So there could be other ways in which it may shift from something that is deductible today to something that's not deductible going forward, depending upon what type of tax or taxes you all are thinking of levying. But a continuing topic, certainly. Okay, let's go ahead and move forward to the next one. This last one, it's just another way of looking at, I suppose, the variability of personal income tax liability and growth. Part of this is due to the kickers. I didn't include 2023 just because it would explode the chart here, so it's not helpful. But even just looking back in the last 20 years or so, you can see the average growth is about 5%, but there's certainly ups and downs, and you can see a couple recessions in there as well. So just something to keep in mind as personal income tax. There would be ways in which you would probably want to manage those revenues coming in, whether that's through reserve funds or something along those lines. Richard?
Kyle, what is responsible for that sawtooth pattern there from 2012 to 2018? Are those kickers every other year?
In some cases, yes. Is the kicker, because it's paid out as in a single year, a kicker is a kicker credit. They reinstituted the kicker credit. So that then changes things where when it used to be a check, it was done outside of the tax system, but since it's become a personal income tax credit, yes, that is part of it. Part of that is there's some fluctuations there as well in some of the early years. But I would say in some of the more recent years, yeah, you are seeing that up and down is in part kicker related. Whether or not there are adjustments being made to take advantage of a kicker as well, that I would say that's also probably in the bucket of could potentially be kicker related. And then it's never going to be a straight line, but that one is, yeah, it caught my eye a little bit where it's like the kicker jumps out as one of the reasons for it being so consistent up, down, up, down, up, down.
I've generally thought of the kicker as if there's increases in tax revenue more than predicted, that it goes back to the taxpayer. But I always thought we brought it back to what would otherwise be considered a baseline. But that 2023 was way below the baseline, making it even more unpredictable. Well, what have I got wrong about that?
No, I think you have that right. It's the kicker itself. It's focused on basically anything that when you exceed 2% of the revenue source, the full amount goes back. And so one, it's not all personal income tax. There could be other taxes that are the estate tax could be contributing to that a little bit. But I think it really comes down to the kicker itself is paid out in a single year, but it represents 2 years of excess revenues, if you will. And that's where you can start to see some of that sawtooth as was described, where in 1 year, you're paying out the full amount of the kicker. And so the next year you jump back up because you're getting back to trend. So it's that full amount. So it's like you can see those kicker years are going to reduce your revenue and then you bounce right back. to trend the next year.
Okay, so generally it's reasonable to think that it gets you back to trend line, it's just that it appears exaggerated because 2 years of payout is reduced to 1 year. Okay, thank you.
Yeah. Yeah. And as seems like Oregon has consistently had kickers. And it has been one of those where it's like when we're in a growth period I'd say for the last 10 years, certainly we've consistently had a kicker. That's just been the way things have been working with forecasts. Certainly around recessionary periods, you don't generally see kickers, but there can be depending on fluctuations in revenue. But even so, you would see some fluctuation there, and something to be aware of is just recessionary times. Ignoring the COVID recession, we had the Great Recession, and then we had the one in 0102 area as well. So it is something that would need to be planned for with reserves, and just knowing that the personal income tax, there is some volatility there from year to year, biennium to biennium. Okay, let's go ahead and move forward. So in terms of the sales tax, thanks. The sales tax base here, I'm using the Washington state sales tax. I believe it's a 6.5% state rate. And again, don't focus too much on the dollar amount, because again, this is going to be Washington's tax base, so it's going to be larger than Oregon's, but it's more to give you some sense of the trend. And so the top chart here is just the revenue collections by fiscal year in this case over the last 20 years or so. And again, you can see some of that recessionary or great recessionary period, but there is no kicker, so you don't see kind of the up and down that we have. The chart below is really just a way of comparing the growth between Oregon's personal income tax and the Washington sales tax. This isn't perfect because the Washington sales tax, the numbers I was able to pull are by fiscal year, where the personal income tax here is by tax year. So there's a little reason why you can see in like the Great Recession period, that 07, 08 doesn't line up. And part of that is just the fact that these are fiscal year versus calendar year. You can see the trend is fairly aligned. I think there has been some challenges with the sales tax not growing quite as fast as the personal income tax. That's just, I think, a general way in which consumption may not grow quite as fast as the income tax. But again, overall, the trends are pretty similar. And I think that was some of the takeaway there. It would depend upon the base. This is just using Washington's base, so you could certainly institute something that's far broader. But something to keep in mind where it's like, the sales tax is certainly a large revenue source that does follow general patterns that follow the economic climate, really. And Chris.
Thanks. I was reading the bullet point about sales taxes being generally regressive. Can you share a sales tax structure that's progressive?
Yeah, that's a really great question. And yeah, that's why I put the bullet in there. In terms of a sales tax, the tax itself is dependent on what the base is. There may be ways to try to get at that where you focus on goods that everybody's buying or are more likely to be purchased by all households or lower income households. But I think generally, if you want to get away from regressive or even get to something progressive, it's going to have to be some sort of rebate. And that rebate would probably be income driven or something along those lines. And that's where it's like, if you were instituting an income tax as well, you could play with the same dollars. Otherwise, if you're thinking, oh, we'll give a credit on the personal income tax side of things, then you start moving, you're raising revenue for universal health care, and you're maybe spending general fund dollars to rebate some of those revenues for lower income folks. But if you're doing both for universal health care, that would be a way to try to limit some of that. Yeah, very good point. Okay, I'm just pausing for a second to see if there's anything else before moving on. Yeah, I think, okay, let's go ahead and switch over to the payroll tax. So the payroll tax, wanted to give two examples that Oregon has in place today that are probably helpful in the conversation. Payroll tax, it's a subset of the income tax in many ways. It's going to be a smaller tax base. It's often going to be levied on wages. Self-employment, that becomes a question, but certainly that would seem to fit with the payroll tax, is focusing on self-employment income as well. So you're not just taxing employees, but also those that are self-employed, which could include independent contractors or something along those lines as well. And then I have breadth of applicability. And that really is touched on how you'd want to do a self-employment and then how to balance it if you want to balance it with a personal income tax as well. Because certainly doing a payroll tax and an income tax could bring up that taxing the same dollar in income twice. So something to think about as you're moving forward. And then initial tax incidents, that's who's paying the tax the first dollar, or who's paying the tax when it's due. So we have initial tax incidents. You can ultimately, where does the tax lie? If you levy a tax on an employer or an employee, there's going to be some balance there. But initial tax incidents is who is responsible for the tax. So is it going to be based on the employers? Is it going to be an employee, or the combination of the two? And then structuring the tax, let's see, dovetails with the employer-sponsored health insurance. Just including that bullet there, as I think this was in the conversation as well, when you're tracking with existing revenue streams versus new revenue streams, whether or not that payroll tax is trying to align with or raise similar revenues or what have you. Just a note of something to think about and how it relates to existing employer-sponsored health insurance payments for the premiums. Yeah, Charlie.
Yeah, so this question goes back to what I've asked before. And your first comment on the payroll tax is a subset of income tax, and I know this is probably again a legal question. Can you do a payroll tax that is not subject to the kicker?
Yeah, I think I would say that is a legal question, but I think you'd be okay with, yeah, that would seem, history would suggest that would be fine.
Okay.
Yeah. And I think that really comes to, at the time that the kicker was put in place and the historical way in which people were viewing things, that was part of the general fund base. So that's how it becomes part of the kicker. But again, yeah, definitely the legal counsel can provide more insight there. Okay, let's move forward one slide here. So the first example is Oregon's unemployment insurance. It's a tax on wages by private employers. One of the differences here, or one thing to think about from a policy standpoint, I suppose, is do you want to tax all the wages or a certain amount of wages up to a certain point? So for the unemployment insurance tax, it's the taxable wages for 2024 at least, would be the first 52,800 of wages paid to each employee are what's subject to the tax. So the amount above that isn't subject to the tax. And those that are familiar, that's somewhat similar to how Social Security works as well, where there's a limit where then income above that, or in this case, payroll above that per employee isn't subject to the tax. And so that's something to be aware of or to think about. The unemployment insurance tax, it's kind of a unique, or I would say it's a unique idea, but it's probably one definitely worth thinking about. Is the benefits are paid formulaically. So in terms of, that's probably outside of what you're all thinking of, because you're thinking health insurance. So that's going to be different. And then the benefits are available to covered employees. But we can go ahead and advance one slide. One of the things with the unemployment is that it adjusts in its own way without requiring a vote by the legislature. So it really does adjust, or it's designed to adjust to potential need. So it's based upon a trust fund balance. And as that trust fund balance becomes lower in terms of compared to expected or forecasted need, the rates for the unemployment insurance go up to try to adjust for that. So it has this self-balancing structure to it. And so in terms of implementing something like that for healthcare, it's implementing a structure. So you could think of it as, we have one bill, one vote on creating this new tax, but it designs a system in which you have parameters that are maybe like, this is the top amount of the tax that you would impose, but it's going to be designed to hit somewhere between that, can't go above that. And then it self-fluctuates to account for differences in costs related to the health insurance spending. So it would be a way to not require adjustments to the tax base or the tax rate each year, every few years, or something along those lines, where it's like you design the system and then it can self-adjust as needed within certain parameters that are put in law. So that would be a way to think about things. Certainly you could manage revenues with reserves, but this would be another way in which to basically you're automatically adjusting the tax reflective of the expected expenditures. And that's somewhat how UI insurance works today. Okay, let's go forward one more. In terms of the tax schedule, the chart here is really showing some of that self-balancing. Now, these are average rates, so individual employers, there can be a lot of variability there just because of how unemployment insurance works. But you can see just by each year that the average rate adjusts up or down, depending on how that trust fund is doing and what those expected expenditures are. Now, this is unemployment insurance, so often it works counter-cyclically in some cases, where we start to see, if we slip into a recession, you'll then see those rates go up shortly thereafter because more people are claiming unemployment insurance, and therefore the trust fund is becoming depleted. But again, you can see where that happened, where the average rates went up and started going up in 09, 10, 11, 12, and then eventually they started coming back down. And that's reflective of the economic conditions improving, the costs on the trust fund going down. So basically the need or expenditures were going down. So the underlying tax rate started to go down on average. Again, certain things can happen. COVID was a unique circumstance where there was legislation required to stop some of this auto adjustment because unemployment insurance just kind of went haywire, I suppose, during the first couple of years of the pandemic. But overall, you can see how this self-regulating tax system can work. Okay, let's go forward. So the next one, I won't spend as much time on this. This is just using Oregon's paid leave program as another example. It has some similarities to the unemployment insurance in that, and it provides a good example because it is recent. It was enacted in 2019. And let me go through it. I'll spend the time to go through it. It's probably worth thinking about a little bit, but where there is the legislation itself had a statutory limit. So we have a 1% limit for this payroll tax. And then it's up more or less depending on what the needs will be for the program, the Paid Leave Oregon, on whether they have to impose that full 1%. Now they have been right now. But again, it's setting a statutory cap on what can be imposed. And then with the idea, it could be something less than that, but it can't be more than that. So it would depend upon the revenue needs. But to date, I think it has been at that 1%. And this one, again, it's taxing the first, it's linked to Social Security. So in this case, it'd be the first $168,600 in wages that's subject to this tax, where the amount above that is not. And it's another consideration for you all on how you're viewing this. Of whether you would have a hard cap or it would just continue, the tax rate would apply regardless of what your wage amount is. So it would continue to go up and up and up. The initial instance on this one, employees pay 60%, employers pay 40%. There is a delineation for the small employers, those with less than 25 employees. They're exempt under the Paid Leave Oregon. So again, that's a way to distinguish based upon small employers. Something to keep in mind because it'll undoubtedly be something that would come up. Yes, Charlie.
So that last thing of employers with fewer than 25 are exempt. I mean, that's one of the things that creates a tax cliff, so that, if a company has 24 employees, adding that 25th employee is going to be really expensive. Has anybody come across that problem, and what do employers do with that?
Yeah, that's a great question. There is a grant program for those less than 25 employees to encourage them, I think, to help cover some of those costs to bring them in. I don't know specifically on that fiscal cliff itself, if how people handle if there's definitely a cost of adding that single employer or single employee, to bring you up to it. And I don't know this program well enough. I do know that there's a grant program to encourage folks to come into that to help offset some of those costs, but I don't know specifically. Maybe that's a good example of, when you do create those fiscal cliffs, maybe you want to phase that in, would be another way to do it. That, of course, reduces revenue with that phase-in period, but that could be one of those where you have different rate amounts based upon your number of employees. So 0 to 15 could be a 0% rate. 15 to 20 could be a quarter of the 1% rate, or something like that could stagger in that fiscal cliff. Which is how a lot of programs, the earned income tax credit is probably a good example of that, where to avoid fiscal cliffs, you do have the value of the credit phases out slowly as income increases. So that's a very good point. And that was, one I know you were all discussing earlier today as well. We're trying to avoid those hard cutoffs because that really changes how employers or employees might respond. And then the last bullet here was equivalent plan. So employers who are providing an equivalent paid leave plan, they are exempt from the tax. They do have to apply. So their equivalent plan does have to be, there are parameters they have to meet to, meet quote equivalent. So that is managed, that is an application process. But that I know, I think it's the ERISA, if how it has been discussed, but that would be another way in which to think about that a little bit. But that does affect your revenues if people are not opting, can basically opt out of the tax and continue to go their own way. But thought is worth mentioning as something that's out there right now. Yeah, Charlie.
Well, onto that last point, ERISA would basically say we could not do that with the health tax because we cannot essentially mention that. So I think that would be a thing we could clearly not do.
Okay. Okay, let's move to the next slide. So this is again sticking with the paid leave or again, and the tax itself. So the blue columns in the chart here are the revenue, where the orange are the benefits and the grants paid. And I just thought it did a good job of displaying, because expenditures, you need revenue for the expenditures. The revenue started coming in first, and then it was a few quarters later that then people could start qualifying for it. So how to bridge that, I know that's been a big discussion point, but certainly this is an example of start bringing the revenue in first, and then people start qualifying for those benefits later. Okay, let's continue on. Okay, so the healthcare provider taxes. This is one that's come up a bit in the past. I will start off by saying I can't speak to how does it work in terms of ensuring the federal match dollars. So these are assessments. We have the hospital assessment, the health insurance plan assessment, long-term care facility assessment. They're called assessments. Like I said earlier, you can call them what you want. It's how they act that matters. In the case of the healthcare provider taxes, most recently, these have not been deemed as bills that are bills to raise revenue, that are imposing a tax. And the rationale for that has been, these are actually, while they do function in many cases like a tax, they do benefit from federal dollars coming in. So it's not really considered a tax because it actually leads to more money coming into the system for those that are responsible for paying the tax, the hospitals, the insurers, the long-term care. So this one, it sounds like from the discussion earlier, it's questionable on whether these sources of revenue would continue to exist. So I think that was the takeaway from, or that's what I heard on your all discussion earlier. But the way that these work right now is because of the federal matching, they haven't been considered taxes, and that's really the reason that they get imposed. Other states do this as well, and my understanding is the rates of these taxes is really based upon the max rate of match you can get at the federal level. So they could certainly impose more of that, but then it becomes an actual tax because you're not getting any federal dollars on that. But so this is just an example of where some of these are imposed simply to raise that federal revenue. So you're bringing more revenue into the system as a whole with those federal dollars. Okay. So I think we're getting to fees, which is, the last place to finish here. Again, the takeaway, if I had one for you all, is just you can call it a fee, but if it acts like a tax, it's going to be considered a tax in terms of the 3/5 vote and everything. But really, in terms of if you're imposing an actual fee, which is just more or less responsive to whatever service someone is receiving at that point. So it really is that close. You pay the fee and you're receiving a service right there. What's the purpose of the fee? And I threw in these two. Is it revenue from the consumption of healthcare? Again, I haven't tracked all of your discussions, but I know the task force, that was a big one where they're really shifting, I think, to no costs out of pocket type of thing. no deductibles, no copays, those things. So whether or not you would want to use fee revenue in place of that, that was just one of those examples. Otherwise, you could be looking at things fairly narrow of a fee for your, your insurance card or something like that. But otherwise, it really is, if it acts like a tax, if it's a general revenue source, it's going to be considered a tax, even if you call it a fee. That was the takeaway on that one. And I think that's where I'll leave it. Happy to try to address any other questions you all have at this time, or yeah, but that's what I have for you.
Any other questions for Kyle before we get back to our original questions on exploring revenue that we talked about at the very beginning of the meeting? Richard.
Yeah, I realize that property tax is exerted by the counties. But I mean, trying to get broad-based low rate, what is any way to look at property tax? How would that fit? Because it's a county tax, but we're doing it at the state level. How would that work, if at all?
Yeah, that's a good point. I made a note of that and then I didn't mention it. Yeah, I didn't include in the slides here. I think it was in the previous one. The property tax base is very large. So yeah, that would be an option of just doing a statewide property tax would be an option. So it wouldn't be a local tax at that point. It would be a state property tax. So that is something you all could certainly consider. Yeah.
And that's not impermissible with any existing law. I mean, it could be permitted if it got voted.
Yeah, there have been discussions on that. It's still going to be subject to the existing constitutional requirements, the measures 5, measure 50. So there would be limitations there. And certainly there's going to be, you will hear from local governments, I think, if you start instituting a local property tax. But again, that's not my area, is not to talk about the politics of it. Obviously the politics of all of this would be big, but yes, that is something that would be available. It is a large tax base as well. Charlie?
Yeah, so one thing that I brought up earlier was corporate income tax, and you didn't mention that. So just wanted to get your thoughts on the feasibility of that. I mean, it's not a big tax base, but it would get a little bit at maybe replacing some of the amount that employers currently pay for employee health care that is not just from the payroll tax. And it would have the advantage of it would get a little bit more from those companies who are actually able to pay it, more so than just what the employer payroll tax would do.
Yeah.
Just your thoughts.
Certainly. Yeah. I didn't include it here. Part of that is maybe from the previous task force on it. They thought about it a little bit, and it's the tax base isn't certainly that large, but it's not like it won't bring in some revenue in terms of a standalone compared to the payroll, the personal income tax, or the property tax. It's not going to be that large, but it would be revenue, right? I mean, we do bring in hundreds of millions of dollars under our existing corporate income tax. There are kicker implications there. It's separate than the personal income tax. There is its own corporate kicker, but it is something that certainly could be available to you all in your deliberations.
And so one more comment related to Richard's notion of property tax. I think although the property tax base is large, I think the constitutionally available base is probably very small. I mean, I don't know how you would estimate that, but because of the limits on the property tax, I would expect that a lot of places are getting pretty close to that limit. So I would expect the available amount is tiny, but I'm not sure.
Yeah, without doing too much, I mean, there's availability certainly under the measure 5 limits. You do start to get into how those get compressed, and it could affect local options. So it could affect revenue of the local governments by imposing a new statewide tax, is my understanding. It's something we could definitely look more into on how that can be balanced, if there's any way within the constitutional parameters and how that would work. Because the way it works right now is general government revenue. If you start to hit up against those measure 5 limits, it compresses or it reduces local option taxes, which are those 5-year options that get put out to a vote first. And so that's where I could see that, where if a new property tax by the state was put in place, and then that reduced revenue for cities, for counties that have local options, you're going to see some of that revenue shifting in that case, where it would be new revenue to the state for the healthcare tax, but it would be at the cost in some cases of local revenue.
Okay, with that, I'd like to get back to the initial question, and Kyle, feel free to join us also for this limited discussion, probably about 10 minutes. And that is, do you want to focus on refining the payroll and income tax options for us, or consider rolling in other options like we've been, like Kyle has summarized here? I can say for myself, after having been on the task force, we just dipped our toe really into sales tax, and then we quickly got out. It was off the table very quickly. But I am really interested in the idea that Chris brought up of a potential progressive sales tax option. We didn't really get into that. And I'm wondering if that would be kind of like taxing targeted items, like not groceries, not essential, basic needs kinds of things, but other things, like I suppose you might call them luxury, or items or things you want but not need. So I'd be really interested in looking at that, and I don't know if any state in the United States that does something like this, or if it's just kind of a flat, like you mentioned, a regressive tax on all the goods. I'd like to know more about that. So that's one thing I'd like to delve into, whether that's before we first refine the payroll and income tax options, I don't know, but I'd like to get some opinions on that so we know the direction we're going to go. Any opinions? Suggestions? Charlie?
But I think what he was brought up with the making a sales tax less regressive, it's not only what you tax, but it's also probably going to require implementing refunds, or I forget what the word was, but some sort of payback allotments to those with low income. And so it would certainly get to be more complicated. I think you're going to require at least a little bit of that, even if you just target more luxury items. And the other piece is, if you just target the higher end items, it's a much narrower base. If you do it on a broader range of items and do rebates, I think you can get somewhere with it. We'll see.
Thanks, Charlie. Richard?
Yeah, I think also we need to keep in mind that Oregon is one of the most progressive tax states in the country, and Washington is one of the least progressive tax rates. And I think we got to balance all these things. There's no perfect tax rate, but Oregon is dramatically out on one end with its reliance on income tax, and few other states have that much reliance. And I think that we're already at the edge of what we can tax people, and companies will leave because they can't attract high earners. So I think that although historically it's been unimportant, I mean, it has been a non-starter in Oregon to consider a sales tax. I think in the idea of a broad-based low rate, it's easy to collect relatively, and make few exceptions for it. We can always rebate those that are at the low end of the income, but I think we need to figure out how to make this stable for the long term. And Oregon is out on one end of the spectrum right now, and we need to balance it. And the sales tax is clearly a way to balance that. Over.
Yes, absolutely. Any other opinions? Chris?
Yeah, I like the idea of finding balance. I think we spoke about this a little bit at the first committee meeting, but I mean, it seems to me that the easiest, perhaps the easiest approach from a political perspective is to, find some tax methodology that results in the individuals and entities who are currently paying for private health insurance to pay a roughly similar amount in taxes to finance a universal health plan. That's a way of balancing things, avoiding making the system more or less progressive than it is now. I think if we consider making, changing that allocation, then we have to think about, does that make the political problem more difficult, and does that make economics in Oregon more difficult? I think what we're seeing in other states in the US and really everywhere is that businesses and individuals are much less geographically constrained, and they can respond more quickly to changes in policy and in particular tax policy. So I think the consequences of implementing a really disruptive tax could be great for Oregon.
Thanks, Chris. Sam?
One thing, one thing I keep kind of coming back to, and I'll use a real world example of myself, is looking at the total tax burden across all of the really major tax areas. So prior to coming to Oregon, my partner and I were looking at moving to one of 6 different states. I looked at the property taxes, I looked at the sales taxes, and I looked at the income taxes. And the way Oregon shook out was the highest tax burden of any of the 6 we were looking at. And so the point here is that I think it's going to be important for us to consider the full tax burden, especially if we're talking about changing multiple tax revenue streams. It's not easy to do, but having some kind of set of case scenarios, here's a person who makes this income, who has, owns their home versus renting, etc., would be helpful to understand the real impacts on Oregonians ultimately.
Good point, Sam. I would just check in with Kyle. Is that data that you can provide to us? Is that something your office would do? Just trying to figure out where we would get that.
Yeah, I think, and this may have been, I think Chris, the head of our office, did some presentation, I think very early on it was to the
Okay.
full board.
Mhm.
And I can look for that where
Okay.
he included some comparison stuff, because it's we put out an annual publication that has that, and it's really pulling mostly from census data to have some of that. But one note on that is it would look a little different too if Oregon begins to raise revenue via taxes for healthcare. That's right now an expenditure that individuals might have that might not show up, right? If you're no longer spending out of pocket, but you're raising that same revenue from taxes, it's going to make Oregon look that much worse, but there would be less expenditures. But those tables in terms of revenue are going to look different for Oregon because Oregon's taxing to afford health insurance rather than paying it otherwise.
Seems like there would have to be big caveats that are labeled just to make sure we're comparing apples to apples.
Just to jump in too, because I think one of our original comments was to, in an ideal world, we develop some kind of calculator where an individual could input a number of different things and see where kind of things shake out financially for them under whatever system is being proposed. But I think we determined that probably wasn't feasible for this committee.
Financially, probably not. But yeah, that's a great idea. Richard?
2 groups that I'm really concerned about taxes are small employers that don't currently provide health insurance. So we say, oh, the employer payroll tax is a great way to shift some of the money that they were paying in insurance premiums back to the employer to help to fund healthcare. But so many employers, especially small ones, don't pay for health insurance. And so a payroll tax would be a huge burden for them. And something we need to consider because it's a whole new set of payments that they have not encountered before. So that's a real concern for me. How do we bring them involved? And we need to know how many employers that would affect. The second one is the self-employed. If you're looking at a high income tax and a high payroll tax on self-employed people, whoa, that's going to be huge because they may not be buying health insurance or they may be paying something on the marketplace. But both the payroll tax and an income tax for people that are self-employed, wow, that's big. And I just think we need a broad base as possible. Thank you.
Thanks, Richard. John?
Yeah, just a couple of kind of random comments. First, I think I would put myself in the category of former task force folks who did listen to the discussions about sales tax, and while it went away at first, it did come back, and you know, but I'm a skeptic that Oregon will ever accept a sales tax. That's number one. Number two, I think the concept of trying to figure out how much are especially employed people paying today for their health care. In some of the earlier materials, I was impressed that there's a lot of employed folks who are paying significant premiums for their health insurance. Many of them probably don't even know it because it occurs, you know, it's just deducted from their check. And how aware really are they of their health plan premium that they're paying? The third thing I just want to mention again, the uniqueness of Medicare. You know, first of all, a payroll tax is hardly going to affect Medicare folks. Most of us aren't working. And so really the only mechanism that could affect us, I think, efficiently is an income tax. And, you know, pardon me to my 65 and over friends, but we are the wealthiest age group in our culture. You know, there's more wealth concentrated in people 65 and over than any other age group. So that's going to have to be dealt with. On the other hand, asking people under 65 to begin to contribute to a Medicare trust fund makes a lot of sense and really satisfies that broad base, can be very progressive because, you know, you're getting younger folks who are years away from needing Medicare to pay in, and so you can accumulate assets over the long haul to be there when they will need to use them. So I think you could justify a Medicare payroll tax for people under 65 as you're going to get better Medicare than you would get if you lived outside of Oregon. So just those three thoughts.
Thanks, John. Charlie, and then I'm going to check in with Bethany if you have anything to add, and we'll need to wrap it up because we've got to go into our reflections. Then we do have one public comment that I know of. So Charlie.
So going back to a comment that Sam made about a calculator, I think we can create a calculator. I don't think it's going to be that difficult once we get a tax structure in place. One of the difficulties is going to be something that John brought up, and that's people aren't aware of what they're paying now. I mean, they can get some information from their W-2 forms, and we'd have to ask them to have that out and ready to provide. But there's going to be a lot of other stuff that they won't. And so the input of their current expenditures is probably going to be way lower than what they really are. And so the calculator is going to probably show them spending more or costing them more. But I think we could do that. I'm not sure how well it's going to work just because of that great uncertainty in the inputs. going to, to the payroll tax, it's something that Richard said. I think you can design a payroll tax that has marginal rates so that you avoid tax cliffs or fiscal cliffs, and also do something to alleviate the small employer problems to some extent. So I think you can do that. Again, that's going to make it more complicated, but it's also going to make it fairer, I think. So we would look for that. I would also say that what I learned, I think we need to get some information from legislative counsel or from some counsel. What I've learned today about the kicker and the relationship to the personal income tax changes my view of what I think might be a reasonable fair tax, because I really do think that the majority of the money needs to come from an income tax for fairness purposes, or at least needs to be based on income somehow. So maybe a sales tax with lots of rebates, but the notion, I'm with John as a skeptic of the possibility of a sales tax in Oregon, but that kicker issue really frightens me away from what I was thinking of before this meeting. So I'm really uncertain at this point.
Thanks,
I'm done.
Charlie. I don't know, Kyle, if you wanted to respond to that or not. Just want to give you the opportunity.
Yeah, I think that's a very good question to ask. And
Oh.
I don't know. I would probably leave it to Morgan might have better insight on whether it's the Attorney General's office could help y'all out, or if it have to be private counsel. Because I know legislative counsel sticks within the legislature, so I don't think they're going to
Okay,
weigh in if you ask them a question.
so it might be the AG.
Yeah.
Okay, thank you. And I just wanted to give Bethany the opportunity to comment if you'd like to on any of these opinions or the discussion.
I don't really have anything to add. I agree with the statement. I don't see how a sales tax is going to get approved, but and what Sam was saying about the total tax burden, but nothing new to add.
Thank you, Bethany. Okay, with that, we're going to go into our reflection segment, and as we mentioned at the top of the agenda, this final segment really is to plan for the next meeting agenda, in addition to the reflections of this meeting, and generate any action items. So I've been trying to keep a running list of action items. This is what I have. We've asked you to send any comments and additional suggestions on principles and attributes to Morgan directly, who will compile the list of the potential additional principles and attributes and will include with meeting materials. The question that I'm not sure I know is whether we'll be ready to vote on this revised set of principles and attributes, this document together at the next regular meeting in January. And so I'm not gonna expect anybody to answer that question, but it is something that I'm wondering about. The second thing is that the health expenditures work is continuing, and I'm wondering if we should share updates at each committee meeting, or at least each regular committee meeting, on how that's working. Does that sound right? Or an update on what's going on and some things to share with the committee? I guess I'll ask Charlie. Go ahead.
Yes, I think we should at least have it on the agenda to share updates, and I can probably other people might have some work they're doing as well, but
Yeah.
I can share of how much time I think is worthwhile to spend on the updates with just what I have, and then you can figure out if there's questions. But
Okay.
it might be that we don't have any updates at some point, but I think we should plan for it unless we learn otherwise.
Okay, sounds good. And then I heard that we did ask Kyle to bring back the total tax burden comparison with potentially the caveats we were mentioning today. And then the other thing that we're asking for is a legal opinion on the issues related to the kicker, and it sounds like it might be the AG. but I don't know that for sure. That's just a suggestion. So that's what I had for action items. Did I miss anything?
Yeah, I really like Samantha's suggestion of pulling those profiles. And then, you know, I would hope that later on when we're designing a tax structure and defining its progressiveness, that we would apply those rates to those profiles just to get some general indication of how our plan would affect individuals and businesses and in those categories. You know, Charlie's comment, I think that that a lot of folks may not even be aware of their own expenditures. I think that's a problem, and it could make messaging really challenging.
Yes, absolutely.
Chris, what's a profile?
Well, I don't know what has been created previously. It sounds like Kyle's going to provide that, but I guess in my mind, what I'm thinking about is, you know, you take different various demographic categories and categories of businesses and try to figure out in general, you know, what's the current burden on that category. And then if we design a revenue plan, how would that category be affected? And it's complicated and it'll be probably hard to create those buckets in a sound way. But it might at least give us an indication of who's going to be affected and in what way.
Okay, Richard?
Yeah, 100% agree, Chris. I was just checking in to make sure the profile was the same as the persona that I was speaking of. I think that's critical. I'm not really sure what the next steps is on the revenue aspect of it. I expect that we need to start applying some rates and but one way to really interpret it, two ways to interpret it. Number one, is it covering the 20 billion that we need? And then number two is go next to the profiles and say, hey, for these major profiles of people that are employed, people that are on Medicare age, people that are self-employed, people that work for employees that don't private insurance, what's it look like? Because that will frame our discussion. Keeping in mind that ultimately Oregonians got to say this is a go. I know the sales tax is a complete unpopular, but if you put it all on high income, they'll get their lobbyists. It'll never get through. At least with sales tax, it's a burden that all of us face. And
Right.
well, and they'll say they don't want a sales tax either, but then everybody is feeling it, not just the high income earners. Over.
Janine?
I just wanted to remind people that although it's not exclusive to tax burden overall, there are some impact scenarios in Optimus's report that you might want to reflect on.
Okay, yeah, good.
They ran some, you know, if you're
That's right.
so should definitely look back at those as well.
Okay, that's homework for.
Oops.
Cheryl, you're muted.
Oops, sorry. Well, we're getting close on time and I want to make sure we have enough time for Tom to provide the public comment. So I want to just very quickly say, this is what we've got on tap for the major topics for the next agenda. That is administrative cost and savings. And then start talking about the structural challenges and additional considerations to avoid a successful ERISA challenge. And again, ERISA is Employee Retirement Income Security Act. So can you think about specific questions that you'd want to address with either of these two topics?
How about more supplemental meetings? Is that also on the list to do?
Yeah, and I'll go to that. So
Okay.
let me say that then. So what we'd like to propose, since the various winter holidays are within these next 2 weeks, is not to have a supplemental meeting this month, but have the next regular meeting in January and schedule another supplemental meeting in January. Would that work for you all? Okay, thank you. It's a little hectic. So we'll do that, and I think maybe we'll need to try to figure out, you know, all of the supplemental meetings going forward in the next, like I said, quarter, maybe even the 6 months would be best. So we'll work on that. Any other very quick reflections from the meeting, and then we'll ask Tom to provide his public comment after that. No reflections from today's meeting? No more action items in between? Okay. All right, well, with that, we're going to invite Tom Sinsick to provide public comment.
Okay, on. Tom Sinsick, retired nurse practitioner. Thank you for this engaging conversation. It was great to listen to. I do the reminders. I'm glad to be at the end, which is reminding that you're doing the work to meet our constitutional right to affordable health care. That's the work you're doing, and keeping that at the center of a focus. And what does ORS 751, which is the law which guides the work, although the task force has been mentioned and as a guiding document, it must keep referencing ORS 751, which is the law currently that says this is the work to be done, which is about creating a just system. Thank you very much for mentoring that word, all right? And then that's the work of the design committee, right? And you have to figure out how to pay for that, right? And we'll let it work. So how to get it passed, I want to say something about this. It is the advocates that got us to this point. It will be advocates that will get us to the inline. So let the advocates do their work when necessary. Just build the best plan and we will get it passed. Just like we got the constitutional amendment passed, how we got this committee passed. So keep that in mind right through the thing. So I want to say property taxes, maybe you mentioned those, but property taxes for cities, municipalities, figuring out how much of that goes into healthcare will be important. Maybe I missed out on that one. Out of pocket, of course, means at the time of service. I think that's what that means. When you go to seek care, you don't have to pay anything at that point. So we might want to look at a revenue that's involved from legislative resources that are put year after year into figuring out how to take care of our healthcare system. There's a lot of money being spent in the state legislature, meeting after meeting after meeting, dealing with these issues. That should be calculated. Now, maybe it's already built into the state tax system, right? That's what pays for it. But keeping in mind that there's money being spent there. I think long-term care, you still should recommend that the governance board create a committee for that. Thank you for mentioning that from time to time. And is there laws that we need to change? Keep that in mind. Is there a law that's in the way that could be changed to make things easier to get some of these things done? I think there is a calculator of some sort out there. Let's see if there's anything else on my list. Okay, I know there's a discussion with California going on. Hopefully the governance board itself is discussing the issue of waivers because that's the California focus. I know there's meetings been going on that maybe should be brought to the report of the governance board itself about what those conversations with California are. And I think, money from nonprofit reserve, that's the last item. That's easy. If you have a not-for-profit, those monies I think can be easily accessed and they can't be diverted to private dollars. So that's basically, I think that's built into the law. So I thank you for your time and Mike, maybe more than 2 minutes. Thank you for not putting a timer on. I appreciate it.
Thank you, Tom, for your advocacy and your support and commitment to this cause. Really appreciate it. And with that, let me just check in with Morgan. Is there anything you want to say in the last couple of minutes of the meeting?
Yeah, thanks. There was one thing that we've been working on is to continue to staff this committee. I think we've talked about it at the governance board meeting, at the governance board, but and we've been talking about it with Kyle. once the legislative session, the Legislative Revenue Office will have another priority, the legislative session. It doesn't mean that Kyle won't be available to continue to support this committee, but we've been working with the procurement folks at DCBS to get an RFP out for some specific revenue modeling and forecasting support for this committee. As you want to look at different tax rates and kind of look at different options, we want to make sure that we have that support. So that RFP was released yesterday. It will be open until January 17th. And if there are organizations or firms or consultants that you've worked with in the past that have done revenue modeling, please email them to me and I'll send them to the procurement folks so they can make sure that they get the RFP.
That's great, and I'm so looking forward to those consultants. Thank you. Jeff, it looks like you have your hand raised.
Yes, thank you. Future agenda item is what is going to be the impact, plus or minus, on the demand for healthcare, depending on the kind of system that gets put in place and its cost and where that cost falls. Demand will rise or fall, depending upon the incentives put in place. I don't think we have a good handle on that yet.
Yes, agree. Thank you, Jeff.
Thank you.
So with that, happy holidays, and we are adjourned.
Bye-bye.
Thanks, everyone.
Bye.
Thank you. Happy holidays.